It's hard to believe that what started out as a small community hospital in 1956 is now a sprawling, state-of-the-art academic medical center, and even more incredible when you consider that the vast majority of this growth has occurred in just the last 10 to 12 years. Why such dramatic growth? Well, that can best be summed up in 3 short words. We are Marshall. When the Marshall University Joan C. Edwards School of Medicine relocated to the grounds of Cabell Huntington Hospital in 1998, a powerful force in regional healthcare was created, a force now called the Marshall University Health Sciences Campus. The main components of this campus are the Edwards Comprehensive Cancer Center, Cabell Huntington Hospital, and Marshall University Medical Center. And the main drivers of its remarkable growth are the highly trained academic physicians and surgeons who provide leading-edge care within these facilities. On the ground floor of Marshall University Medical Center, you'll find the Department of Orthopedic Surgery, a growing team of experts from every subspecialty of orthopedics, joint replacement, sports medicine, foot and ankle care, hand and upper extremity care, back and spine care, orthopedic trauma care, and orthopedic oncology. Quality care is this department's main objective, and their results prove it. HealthGrades, the nation's leading independent healthcare ratings organization, has repeatedly ranked Cabell Huntington's joint replacement and orthopedic services #1 in quality in West Virginia and the Tri-State, as well as in the top 5% of all hospitals in the country. Also on the ground floor of Marshall University Medical Center is the growing Department of Neuroscience. Here, highly trained and experienced neurosurgeons provide a wide range of the most advanced surgical options for people with diseases and injuries of the brain, spine, and central nervous system. The department is also home to a diverse team of highly specialized adult and pediatric neurologists who offer leading-edge care and treatment for a multitude of conditions, including epilepsy, movement disorders, sleep problems, and neuromuscular diseases. On the first floor of Marshall University Medical Center is the Department of Family and Community Medicine. The Joan C. Edwards School of Medicine is a national leader in the training and development of family and primary care physicians, the backbone of our nation's healthcare delivery system. And the physicians who practice here pride themselves on staying up to date with the latest advances in this vitally important field of medicine. The Department of Surgery is located on the second floor of Marshall University Medical Center. Here, experienced general surgeons partner with specialists in plastic and reconstructive, oral and maxillofacial, bariatric, thoracic, urologic, and oncologic surgery to provide the region with its largest, most comprehensive, and most advanced surgical team. A growing focus of the Department of Surgery is minimally invasive surgery, or surgery through tiny incisions that result in less pain, improved quality, and a quicker recovery. The Department of Pediatrics is on the third floor of Marshall University Medical Center. It boasts not only the largest and most experienced team of general pediatricians in the region, but also the largest, most experienced, and most comprehensive team of pediatric subspecialists. Pediatricians who specialize in neonatology, pediatric endocrinology, gastroenterology, surgery, cardiology, allergy and immunology, oncology, behavioral medicine, and critical care. And on the fourth floor of Marshall University Medical Center is the Department of Obstetrics and Gynecology, the region's largest and most comprehensive team of women's care, maternity, perinatal, and infertility specialists. The Department of Obstetrics and Gynecology was the region's first to offer women daVinci hysterectomy, and now has access to 2 state-of-the-art daVinci SI surgical systems at Cabell Huntington Hospital, the only hospital in the region to have 2 such systems. Just 1 block away is the most recent addition to the Marshall University Health Sciences campus, the Erma Byrd Clinical Center, located on the former site of Fairfield Stadium. This state-of-the-art facility is home to Marshall's Department of Internal Medicine Specialties, and the Department of Cardiovascular Services. One of the crown jewels of the Marshall University Health Sciences campus is the Edwards Comprehensive Cancer Center, a one-stop shop for comprehensive cancer care, where patients can receive the latest diagnostic and therapeutic services, clinical trials, education, and support, all under one roof. Here, patients can be seen by the region's largest and most experienced team of medical oncologists and hematologists, each with significant experience in treating patients with a wide range of cancers and blood disorders, using the latest advances in chemotherapy and other medical treatments. Radiation oncology is another key component of the Edwards Comprehensive Cancer Center. Using precision technology, the radiation oncology team here is able to deliver powerful doses of radiation to the exact cancer site while sparing normal, healthy tissue. And when surgery for cancer is needed, patients can count on the region's largest, most advanced, and most comprehensive team of surgical oncologists. Surgical specialties here include advanced breast cancer surgery by surgeons in the Comprehensive Breast Center, gynecologic cancer surgery by one of only 4 gynecologic oncologists in West Virginia, orthopedic cancer surgery by the state's only orthopedic oncologist, daVinci prostatectomy and other robotic urological procedures from the region's most experienced daVinci surgeon, and daVinci abdominal cancer surgery from the region's only daVinci abdominal cancer surgeon. And when you add the Tri-State's only Pediatric Oncology program to the mix, you can see why this facility is called the Edwards Comprehensive Cancer Center. The most recent addition to the Marshall University Health Sciences campus is Cabell Huntington Hospital's North Patient Tower, a 6-story, $85 million state-of-the-art hospital facility that ushered Cabell Huntington into a new era of patient care and comfort. On the first floor of the North Patient Tower is a new emergency department and Level 2 trauma center. The emergency department is located just off Halgura Boulevard, with quick, easy access and ample covered parking. Upon entering the emergency department, patients and visitors are greeted by a large, attractive, and comfortable waiting area. Adjacent to the waiting area are 2 spacious and private triage rooms, where patients are assessed for the severity of their illnesses and injuries. Following triage, patients are moved to one of 30 new and comfortable exam rooms, each outfitted with advanced computer systems and the latest patient care technology. And at the center of the department is a large state-of-the-art nurses station, the nerve center of the ER, that allows for easy visual access and quick response to all patients. For the most seriously injured patients, Cabell Huntington Hospital, a joint Level 2 trauma center, has 5 large and well-equipped trauma rooms. Trauma patients are brought to Cabell Huntington by ambulance, or they can be transported by helicopters, which land on a dedicated helipad adjacent to the trauma unit. And the youngest of patients are brought to Cabell Huntington from all across the region by a dedicated Pediatric Transport team that provides critical life support to infants and children on their way to the hospital's neonatal and pediatric intensive care units. Because Cabell Huntington is also the only hospital in West Virginia and the Tri-State region with a burn intensive care unit, it also receives burn trauma patients from a wide geographic area. On the second floor of the North Patient Tower is post-surgical nursing, a 38-bed unit that cares for patients who've recently had surgery. Like all units in the North Patient Tower, this unit features large, comfortable private patient rooms with plenty of sunlight. Patients and visitors here also appreciate spacious carpeted hallways, which allow for a more quiet and pleasant experience. Even the smallest of details in the North Patient Tower make a big difference, like nurse servers, which allow support staff to supply patient rooms with linens, pharmaceuticals, and other medical supplies without having to disrupt the patient by actually entering the room. Patient privacy is also one of the reasons for these nurse viewing stations, located between every 2 patient rooms. They not only give nurses the ability to check and enter important medical information on the central computer system, but allow them to visually check on a patient through a small window without having to enter the room. Families and visitors were also considered in the design of the North Patient Tower. Each floor features large, comfortable waiting areas, as well as smaller family consultation rooms. The third floor of the North Patient Tower is home to the region's busiest labor and delivery unit. This unit features 18 large, attractive, and comfortable labor rooms, outfitted with the most advanced childbirth technology available. With about 2,600 annual deliveries, more babies are born at Cabell Huntington Hospital each year than at all other hospitals in the Tri-State area combined. On the fourth floor of the North Patient Tower are Cabell Huntington's highly advanced intensive care rooms. Here, each intensive care patient has a private room equipped with the latest monitoring and life-saving technology anywhere. And this unit was carefully designed to provide patients with maximum exposure to sunlight, proven to aid in the recovery process. The fifth floor of the tower is home to 2 separate units, the Inpatient Oncology Unit and one of the most unique and advanced neonatal intensive care units in the country. This Level 3 NICU, one of only 3 in West Virginia, has 36 Level 3 beds, the vast majority of them in large private rooms. Many of the babies in this unit stay here for weeks and months, so family comfort was a major consideration in the design of the NICU. Moms and dads are welcome and even encouraged to spend the night here, and the spacious, comfortable accommodations allow them to easily do that. What's next on the horizon at Cabell Huntington Hospital? a new children's hospital designed with the unique needs of children and their families in mind. We're well on our way to raising the $12 million needed to build this dream, and we hope you'll help us make it a reality.